Hello guys, how are you all? Good evening, good evening. Devendra Solanki, hi Devendra. Mehnaz, good evening. Suraj, good evening. Maithili, Jeshwant, Rishit Verma. Rajvardhan, Tamil speaker. Riya Singh, Lipika. All of you, good evening. How are you all? Hi Najmul. How are you all? Are you all doing great? Right. Hello Vanilla. Mandru Sanjay. Hi, good evening. Hello guys. So today yesterday we have covered the basics, and yesterday those of you haven't understood the class, right? Haven't attended the class. Sorry, haven't attended the class. So I want you to attend today because आज का topic है joints. I think all of you know about these joints because you have studied in year +1 and +2. Okay, this is a very easy topic, but there are some things that are little bit different. Okay, uh, Patan afroze yesterday there was some technical issue, right? So that is the reason why we couldn't send the notes, but we'll send it immediately today. Okay, so the technical issue is solved by afternoon today, so we'll send it immediately. So Sujit, we'll put a link down. Okay, so after the class, and automatically you can log in into that. Okay, you can join the Telegram. Bunny, hi Bunny. Varun, Suraj Kumar, I'm fine. Suraj, thank you so much. Hi Mansi Patil. Chalo. Now, today what we shall do is that we shall discuss completely about joints. I hope you have some knowledge about joints, right? You know what are sutures, what are syndesmosis, gomphosis, right? There are some joints called fibrous joints, cartilaginous joints. So you have some sort of knowledge about the joints. ऐसा नहीं है कि बिल्कुल zero है ना? You have some sort of knowledge, right? So I think you must have already grinded this subject a lot, right? So chalo, let's start discussing the joints. Okay, now all of you stop commenting. I'll come back to you. I'll come back to you. I'll come back to you guys. Stop commenting and watch whatever I'm teaching you. Okay. Isfakur Rahman, good evening. So we shall be discussing about the joints. Okay. So within these joints, there are two types of joints. Okay, first of all, there are two types of joints. Safi, hi Safi, good evening. So regarding these two types of joints, what you need to know is that, guys, देखो, joints are basically classified into two types. Okay, what is the function of the joint? That is called as functional classification. What is the structure of the joint? That is called as structural classification. Okay, functional classification matlab within this functional classification there are three things. Okay, before I discuss, first of all, write down whatever I've told you. What is the function of the joint? That is called as what classification? That is called as functional classification. Structure of the joint के बारे में अगर discuss किया तो that is called as structural classification. Okay na? So functional classification and structural classification. Now, within this functional classification, you have got three types. For example, just look whatever action I'm doing. For example, if I'm rotating this, what is this joint, by the way? All of you know this is shoulder joint. Hai na? For example, if I'm rotating my shoulder joint, when I'm rotating my shoulder joint, now you will tell me that is this joint freely movable? Is it moving freely, or is it moving slightly or completely immovable? Yeah. Out of these three things, is it moving freely, or is it moving slightly, or it is completely not at all moving? Very good, very good. This is a freely movable joint, right? So this functional classification mein pehla wala, the shoulder joint is a freely movable joint. So within this functional classification, we have got three important joints. So one is called as freely movable joints. Freely movable joints. Very, very good. Very good. Second important thing, guys. Abhi, all of you know we have got vertebra, है ना? एक vertebra between one and second vertebra, right? Whatever it is. एक vertebra दूसरा vertebra के बीच में we have got one joint. All of you know that is called as intervertebral disc, right? All of you know disc bulging, है ना? Disc protruded outside, disc pain. So you listen to these terms again and again in your entire MBBS, okay? So between one vertebra and another vertebra, there is a disc. Now this disc is nothing but called as intervertebral joint. Now I can bend back like this. I can bend forward. Now when I am telling I can bend back, can I touch my head to the buttocks? No, I will break my spine, right? So I can bend, but not completely. You're getting it. So tell me whether am I moving, is this joint slightly movable or completely immovable? It is slightly movable. Okay. So second important is slightly movable joint. And third important thing matlab, all of you look here, this is your skull. Okay. Now within your skull, all of you know we have got these sutures like this. You know these sutures, right? We will discuss about sutures now. Okay. You know we have got a sagittal suture, we have got coronal suture, or पीछे यहाँ पे lamboid suture है, right? So these sutures, what are they doing? They are closing two bones like this. Now, do you think my skull is movable? Can I move these two bones? No, they are closed completely with the help of sutures. So sutures are immovable. Okay? Sutures क्या होगा? Sutures are immovable. So we have got freely movable, we have got slightly movable, and something called as immovable joints. Immovable joints. Clear all of you, right? Now this is something that is very basic, guys. ठीक है, कुछ technical terms use करेंगे यहाँ पे. Freely movable joints, slightly movable or removable. Freely movable joints are called as diarthrosis. Freely movable joints are called as diarthrosis. These are called as diarthrosis मतलब joint. ठीक है, di मतलब it is movable in two directions है ना. So diarthrosis. Slightly movable joints. ठीक है, slightly मतलब half को क्या बोलते हो? Amphi, right? These are called as amphiarthrosis. Amphiarthrosis. और immovable joints. Immovable they are not moving. Why? क्योंकि दो bones जो है ना, they are completely fused है ना, इसीलिए they are not moving. So these are called as synarthroses. Syn मतलब क्या? Fusion. Okay. Arthrosis मतलब joint. Fusion of joint is called synarthrosis. So तीसरा है synarthrosis. Synarthrosis. Okay. So we have got three different types of joint: diarthrosis, amphiarthrosis, and synarthrosis. And by the way, you will tell me the examples now. The first example, freely movable joint, what was one example? We will discuss about that later on. One example दे दो. एक example. One example is very good. That is your shoulder joint. Shoulder joint. Second important thing, slightly movable. What did I tell you? Joint between two vertebrae. What is that? Intervertebral disc. Hai? So this is one vertebra. This is another vertebra. Between two vertebrae, you have got a disc like this, and this disc is called as intervertebral disc. Intervertebral disc. Very good, Najmal. Ball and socket joint. Yes, shoulder joint is a ball and socket joint. Very good. So synarthrosis are what? Sutures, right? What sutures? Sutures मतलब ये भी हो सकता है, right? You are stitching a patient, if there is any laceration, वो भी suture हो सकता है, right? These are skull sutures, okay? These are skull sutures. So this is all about the functional classification, guys, okay? So these are the three types of functional classification: freely movable, slightly movable, immovable, okay? Diarthrosis, amphiarthrosis, and synarthrosis. Now we shall discuss structural classification of a joint. What do you mean by structural classification? We shall discuss structural classification of a joint. What do you mean by structural classification, guys? Structural classification matlab what is the structure of the joint is called as structural classification. For example, let us say this is one bone, this is another bone, okay? Both the bones are joining together. Now, this is the joint, yes or no? Where are they joining together? This is called as a joint. Abhi, if this joint is made up of fibers, this is called as fibrous joint. If this joint is made up of cartilage, this is called as cartilaginous joint. अगर ये joint के बीच में, in between this joint, if there is synovial fluid or synovial cavity, this joint is called as synovial joint, right? So structurally also we can classify the joints into three types. Okay, what are those three types? The first one is called as fibrous joints. First one is called as fibrous joints. Okay. Second one is called as cartilaginous joints. Second one is called as cartilaginous joints. And third one is called as synovial joints. Third one, you call it as synovial joints. Okay. So we have got three different types of joints here. One is called as fibrous, cartilaginous, as well as synovial joints. Okay. So it is based upon the structure. Again, I'm telling you, fibrous joints are having fibers, cartilaginous joints are having cartilage, or synovial joints are having a synovial fluid or synovial cavity within that. Okay. Now comes the important thing. My voice is not clear. Am I audible? Audible, right? Very good. Now coming to this fibrous joints, right? Coming to this fibrous joints, one very important thing you have to know, that all of you look at the first letter. First letter is F. F stands for fibrous. F also stands for fixed joints. Okay, F stands for fibrous. F also stands for fixed joints. What do I mean by fixed joints? Fixed joints in the sense joints which do not move. है ना, joints which do not move are called as fixed joints. Joints which do not move मतलब we already discussed, they are called immovable joints. Immovable joints are another name क्या है? Synarthrosis. So can I tell that fibrous joints are nothing but called as synarthrosis? Yes, fibrous joints are nothing but called as your synarthrosis. They are nothing but called as your synarthrosis. Okay. In the same way, coming to synovial joints. Okay. Synovial joints matlab which have got a synovial cavity. Don't you think ball and socket joint, the shoulder joint is having synovial cavity? Don't you think the hip joint is having synovial cavity? Don't you think the knee joint is having a synovial cavity? Right? So shoulder joint is a freely movable. I told you already. Hip joint is freely movable, knee joint is freely movable. So freely movable joints are called as diarthrosis. So in that context, can I call synovial joints as diarthrosis? Yes, synovial joints are also called as diarthrosis. Or what is left now? What is left? The last thing that is left is amphiarthrosis. So cartilaginous joints are amphiarthrosis. Amphiarthrosis. Okay? Amphiarthrosis. So till here you are clear. Now what we shall do is that within these fibrous joints, there are three different types of joints. Okay, within these fibrous, there are three different types of joints. What are these three different types of joints? For example, one example you already know. Fibrous matlab synarthrosis. Synarthrosis ka example skull sutures. I already told. So let me write it down. So skull sutures. Skull sutures are one example. Okay. Second example is syndesmosis. Syndesmosis. Okay, guys, after this we shall also do the MCQs also. Let us see the MCQs which are asked in the exams. Okay, let us see how much you will be able to do it. Okay, chalo. Skull sutures, syndesmosis, and uske baad aayega gomphosis. Gomphosis. Okay, so if someone asks you what is the classification of fibrous joints, they are classified into three types: skull sutures, syndesmosis, gomphosis. Okay? First what we shall do is that we shall discuss in detail about these fibrous joints. Uske baad we will discuss about cartilaginous and then synovial joints. Okay? First our topic of discussion is fibrous joints. Fibrous joints. Okay? So I'm writing here only fibrous joints are also called as synarthrosis. Synarthrosis. Now within this fibrous joint, the first thing we shall be discussing is skull sutures. Okay? Skull sutures. So first thing we shall be discussing is sutures. Now when I tell sutures, everyone have to know this very important thing. Okay? What is this important thing? All of you should know that this bone here which you see, this is called as frontal bone. Okay, this thing you studied in your +1 and +2 already. Okay, you studied in your +1 and +2 already. Okay, so this bone over here is called as your frontal bone. After that, you see these two bones here, these two bones are called as parietal bones. These two bones are called as parietal bones. And when you go back here, here you have got a bone, this is called as occipital bone. Okay, uske baad, you see this bone and this bone on the sides here, right? These two bones here, these two bones are called as temporal bones. So what are the bones we have got? Frontal, दो parietal, दो temporal and one occipital. Okay, so these are the bones. अभी ये bones के बीच में दो sutures है, these are called as skull sutures. Okay, so now all of you you haven't studied this in +1 and +2. At least ये तो जानते हो ना, at least you know this thing that there is something called frontal, there is something called as parietal, occipital, temporal, right? You know this basic thing, right? Hello, Sajda. So now we shall, I will draw a picture and I will explain you what are the names of the sutures, because these were asked in the exams. Okay? So all of you just look at the picture. By the way, even if you don't know, you will be cleared by the lecture. Don't worry about that. ये देखो. Right. Now, here if you see, let us say this bone in the front, whatever I have told you, right? See this bone in the front, which you can see from the side, this bone in the front side here, this is called as your frontal bone. Okay, this is called as your frontal bone. After frontal bone, this next bone here, what is this bone? This is called as parietal and this is called as temporal. Okay, so the next bone which I'm drawing right now is your parietal bone. Okay, so this bone over here is your parietal bone. Okay, after the parietal, ye piche, what is this bone? This is called as your occipital bone. Okay, so the last bone on the back you got, this is your occipital bone. Now what I'm trying to explain you here is that this is frontal, parietal, occipital. Okay, between the frontal bone and between the parietal bone, I have got a suture. In the same way, between the parietal bone and between the occipital bone also have got a suture, right? So the suture that is present between frontal and parietal bone is called, see, combine both the words, frontal, parietal, दोनों को combine करके fronto-parietal suture. Okay, this is also called as fronto-parietal suture. Fronto-parietal suture is also called coronal suture. Coronal suture. It is also called as coronal suture. So this is a very important thing, guys. You have to know what is coronal suture. Okay, so this is a very, very important thing. Okay, in the same way, there is a suture that is present between parietal and occipital, right? This suture is called as occipito-parietal suture or parieto-occipital suture. Okay, you need not to know that, but you need to know another name for that, and that is called as lambdoid suture. That is called as lambdoid suture. Okay, so here what are the two different types of sutures we discussed? One is called coronal suture and दूसरा क्या है? Lambdoid suture. Okay, so these two sutures you have to remember. So one example I have already given it to you, that is regarding the sutures. So I hope till here whatever I've discussed, all of you are clear, guys, right? Just give me a green signal. I'll start on the remaining thing. I'll continue with the remaining thing. All of you are clear with this till here? Sajda, if you already know about the joints perfectly, then you can leave, or else you can stay. Okay, because in this class we'll be discussing about the MRI scans also. I will also teach these first year students how to look at an MRI scan and diagnose the patient also. So it is your wish, right? Very good. Now all of you look here. Now I told you about sutures, right? I told you about sutures. there are different types of sutures, there are different types of sutures. For example, what I'm trying to tell you is that the first important thing is, yeah, देखो, this is one bone, okay, this is one bone, and this is another bone, okay, bone number 1 and bone number 2, both the bones are joining together, and if you clearly look, the surface of both the bones where they are joining, these surfaces are even or uneven. Yeah, these surfaces are smooth. You see, both the surfaces are smooth and even. है ना? This kind of joint is called as plain suture. This kind of suture you call it as a plain suture. Such kind of suture you call it as a plain suture. Okay, just look at this. All of you know what is maxilla? Yes or no? All of you know what is maxilla. Devendra Solanki, okay, even, that is not a problem even if you didn't study, but you have to study it here, okay? So this is very important. So I hope Devendra, you are understanding whatever I'm telling you, okay? Very good. So if you look at this maxilla here in the palate, right, between the two maxillae, there is a suture in between. So all of you can look at the suture now very clearly, and this suture, both the surface of the suture are plain, right? That is why I call this as a plain suture. I call this as a plain suture. Okay. After this plain suture, second important thing is, look at this bone. This is one bone. This is another bone. Okay. But look at both the bones. The surfaces of both the bones are also same, right? They are also even. But difference kya hai? Difference is this, that one bone is overlapping on another bone, right? So such kind of suture you call it as squamous suture, right? All of you remember squamous epithelium, right? So this kind of suture is also called as squamous suture. This kind of suture you called as squamous suture. Now all of you look at the picture. All of you look here. In this picture, you know this is parietal bone. Okay, you know this is temporal bone. But can you see that there is some kind of, let us say there is some kind of groove, right? Or there is some kind of separation between the temporal and parietal bone. Actually, what is happening is that the temporal bone is overlapping on the parietal bone. That is why you can see a kind of separation like thing over here, right? You see this over here, right? So this kind of suture between temporal and parietal bone is your squamous suture. Okay, that is your squamous suture. Clear? Right. So, ye dekho, this is your parietal, this is your temporal. Now, next important suture. In this suture, this is one bone. Look at the ends of the bone. Ye dekho. This is end of one bone, and let us say this is another bone, and this is the end of another bone. Okay. Now tell me, both the ends are equal, I mean even or uneven? They are uneven. Why? Because both the ends are looking like a saw edge. Yes or no? Saw edge. इसीलिए इसको बोलते हैं saw edge sutures or serrated sutures. Why serrated? Because there are serrations. These are called serrations. Okay. That is why such kind of suture, you call it as a serrated suture. Serrated suture. Serrated suture, or it is looking like a saw edge, right? That is why you call it as saw edge suture. Saw edge suture. Okay. All of you understood what is serrated suture or saw edge suture, guys? I hope no doubt in this, right? So where are these serrated and saw edge sutures? If you look at this picture, you will understand. You see here, this is your parietal bone. This is your parietal bone. Okay. Between the two parietal bones, look at this thing. You see serrations from both the ends like this. Both of them together, they are interclogging each other and forming a suture there, right? So these are called as serrated sutures. Very, very clearly you can see that, right? You see serrations of one bone like this and serrations of another bone also. Okay, so such kind of suture you call it as a serrated suture. And the last type of suture we will be discussing now, the fourth important and the last type of suture, very important. Just look here. This is one bone. Okay. Now just look at the joint surface of the bone. Okay, this is another bone. Now look at the joint surface of this bone also. You see, what are these doing? See, one bone is having a processes, these are called as tooth-like processes. Okay, tooth-like processes of one bone are fitting into tooth-like processes of another bone. So tooth matlab in Latin, what do you call it as? Right, you call, in medical terms you call it as dentate, right? So such kind of sutures are called as tooth like sutures, or technically speaking it is called as dentate sutures. Okay, such kind of sutures are called as dentate sutures. Dentate sutures. Okay, dentate suture, yes Najmol, even that is also a serrated suture, you are right. Okay, so all of you look at this. All of you look at this bones here. See, these two are parietal and this is occipital. मैंने क्या बोला था, parietal और occipital के बीच में जो joint है, that is called as lamboid suture. I told you, right? So in this picture, if you look clearly, I told you between parietal and occipital you have got lamboid suture. Now the same suture is here, isn't it? You see, this suture which I'm drawing right now, which is in the shape of a lambda, is called as lamboid suture. Okay, suture which is in the shape of a lambda is called lamboid suture. And you can see in this lamboid suture very sharp dentate processes. You see, I'll draw one of them. You see, these are the dentate processes. Okay, I hope you understood what are these dentate processes over here. Okay, so such kind of suture you call it as dentate sutures. Okay, so overall guys, within these sutures topic, within these sutures, within the fibrous joints, we discuss about sutures. What are the different types of sutures we discuss? First suture we discussed is called as a plain suture. Second suture we discussed is squamous suture. Squamous suture. Third suture we discussed is serrated suture. Serrated suture. Fourth important suture we discussed is dentate suture. Dentate suture, right? So these are the four different types of sutures which we have discussed. All of you are clear regarding the sutures before I move on to the next topic? All of you are clear regarding this thing? Just now we discussed fibrous joints. Within this fibrous joints, we discussed sutures. Now I will be discussing syndesmosis and gomphosis. Before that, I just want a green signal from you whether all of you are clear or no. Yes? Srishti, very good. Very good, very good. So these are the different types of sutures which you will see. Okay, right. Now the second important type in the fibrous joints after sutures is syndesmosis. Okay, syndesmosis. Guys, tell me this thing. All of you know what is tibia and fibula? Tibia and fibula are the bones of the leg, lower limb. All of you know this thing, right? So in syndesmosis, we have got across two important examples. Okay? What are those two important examples? All of you just look. This is one bone. This is another bone. Okay. Devendra, see in the upper limb here we have got two bones, right? One is called radius, one is called radius bone, one is called ulna bone. Okay, I'll show you these bones. Okay, so one is called as radius, one is called as ulna bone. In the same way, in the lower limb also we have got two bones. Okay, what are those two bones are? One is called tibia, one is called as fibula. Okay, one is called tibia and the other one is called as fibula. These are the two bones that are located in the leg region. Okay, now when I'll draw another picture, you will understand. Right, I hope you understood this picture. Devendra, you understood this picture, whatever I've drawn here? This is the exact picture of your lower part of the leg. Okay? Upper part of the leg, lower part of the leg. So this bone over here is called as your tibia bone, and this bone over here is called as your fibula bone. Okay? Tibia and fibula. Now, why am I telling you this is that between tibia and fibula, there is a joint. This green color, from now onwards, whenever I draw a green sketch in between the bones, that is the meaning of a joint. Okay. Now, this joint, whatever you can see, is located between tibia and fibula. Now, tell me, it is located in the lower part of tibia fibula or on the upper part of tibia fibula? It is located on the lower part of tibia fibula. Lower, yesterday's class, मैंने क्या बोला था? Anything which is on the top is called superior. Anything which is on the bottom is called as inferior. Now tell me, if this is located in the bottom, you should call this as inferior or superior? You should call it as inferior. Very good. Inferior or joint kahan pe hai? Joint is between tibia and fibula. Okay, that is why this joint is also called as, combine two words. Rendu words ni combine chesi cheppandi. Tibia and fibula. Then you call it as tibiofibular joint. Okay, inferior tibiofibular joint. Inferior tibiofibular joint. So one example of syndesmosis is inferior tibiofibular joint. What is the second example? Very good, guys. You are answering perfectly well. Very good. What is the second example is, in this second example, you can see two bones here. Right? These two bones are the bones of your forearm. What are these two bones? See, this bone is called as your radius. This bone is called as your ulna. Okay. So where are your radius and ulna? See, this bone on this surface laterally is called as radius, which is medially towards the midline. Yesterday I told you this is called as ulna. Okay. So it means this ulna is located here like this, and this radius is located on the opposite side like this. Okay. Radius and ulna. Now, sir, how to identify both the bones are same, looking same? How will you identify that this is ulna and this is radius? What is the first letter of ulna? U, right? Look at the shape here. What is this shape? This is also U. So this is ulna. If this is ulna, opposite one will become radius only, right? Right. Now, just look at this radius and ulna here. See, this bone is called as your radius bone. This is called as your radius bone. And after that, this bone is called as your ulna bone. This is called as your ulna bone. U stands for ulna. Why am I telling you this is, radius or ulna ke beech mein, between radius and ulna, you have got three types of joints. One joint is located on the top. One joint is located in the middle. One joint is located on the bottom. Okay. There are three types of joints. So the joint which is located on the top, middle and bottom, you will name me. That top one, you should always call it as inferior or superior. I should call it as superior. Superior. Okay. Which is on the bottom is called as inferior. Which is on the bottom is called as inferior. Which is in between both of them is called as the middle. Right. Which is in between both of them is called as middle. So what is the name of the joint? Joint is between radius and ulna. Again, combine both the words. Radio-ulnar joint. So, superior radio-ulnar joint. Superior radio-ulnar joint. Next, we have got middle radio-ulnar joint. Next, we have got inferior radio-ulnar joint. Inferior radio-ulnar joint. Okay. Now, right now, our discussion is about syndesmosis. Right? Syndesmosis are a type of fibrous joints. Fibrous joints are those joints which are immovable. Immovable. Right? Now, out of these three joints, which are immovable joints, only and only middle radio-ulnar joint is immovable. This is immovable. Okay? Baki do, the upper one and lower one, both of these joints are movable joints. Okay? This is also a movable joint. All of you understood? So this is an immovable joint, and the upper one and the lower one together you call it as a movable joint. Sir, how do you prove? How do I prove is that all of you know that what is pronation and supination? Pronation is when you are promising someone, this is pronation. Right? When you are receiving something, this is supination. How is this pronation and supination happening, guys? How is this pronation and supination happening? This pronation and supination are happening because of superior radioulnar joint and inferior radioulnar joint. Okay, if you want, I'll prove it right now. All of you just look at the video over here. Okay, now in this video, you can see the pronation and supination, right? So there is a lag, I think. Right. You see this is a superior radioulnar joint which is showing right now. See, this joint over here is superior radioulnar joint. Okay. Now you will see pronation. See, this is called as pronation. Okay, this is called as pronation. You see there, guys, all of you can find one thing. Ulna bone is not moving, but radius is overlapping on ulna. Right? See, this radius is overlapping on ulna, but you cannot overlap the ulna on the radius. Can you rotate your arm like this? No. Right? So that is what is happening here. Pronation, supination. Pronation and supination. Okay, so I hope all of you are clear with whatever I told you. Okay, so this pronation and supination are happening because of superior radioulnar joint and inferior radioulnar joint. So what is our example for today's topic? The example for today's topic is middle radioulnar joint. So from today onwards, if I ask you what are the examples of syndesmosis, what will you tell? There are only two examples of syndesmosis. One is inferior tibiofibular joint and middle radioulnar joint. Okay. So this is one example. This is one example. And the second example is middle radioulnar joint. Middle radioulnar joint and inferior tibiofibular joint. These are the examples. Syndesmosis are little bit difficult, guys, but all of you understood. All of you understood. I want a green signal from all of you. You understood or no? From now onwards, topic is going to be really more interesting because many clinical things and many pictures I'm going to show it to you. So all of you are clear till here? Very good. Very good, Srishti. Right. Good evening, Anand Prakash, SK Najmul. Very good. Kiran Yadav, you understood. Riya Singh, Devendra. Jay Siddharth, Bunny, Patan Afroz, right? Cheguri Princy, Lipika Padmini, you understood? Sajda, you understood? Akshata Mali, you understood? All of you understood, right? Very good. Now the third important thing and the last important thing we shall be discussing is the gomphosis. Within the fibrous, third wala, sutures, syndesmosis and gomphosis. Third important thing is gomphosis. Okay, so let us see what are gomphosis. Okay, gomphosis, what are gomphosis? You know, the joint, the teeth joint is called as a gomphosis joint, right? So all of you know what are gums. Yeah, these are gums, these are your gums, right? And all of you also know that these are your teeth, right? So this is a tooth, this is a tooth, and here you have got the joint like this. Okay, so here you have got a perfect adherence over the joint. So this joint which in green I'm drawing is your dento-alveolar joint. Okay, this kind of joint is called as dento-alveolar joint. Dento-alveolar joint. Okay, or also simply call it as a gomphosis joint. You can call it as gomphosis joint or dento-alveolar joint. Right, so this is all the discussion you need to know regarding the sutures, syndesmosis and gomphosis. We are done with fibrous joints, guys. And now we shall move on to the second important joint, that is cartilaginous joints. Okay? So let us discuss what are these cartilaginous joints. What are these cartilaginous joints? Guys, basically there are two different types of cartilaginous joints. Okay, what are those two different types of cartilaginous joints are? One is called as primary cartilaginous joints, One is called as primary cartilaginous joints, okay, and the other one is called as secondary cartilaginous joints. Okay, one is called as your primary cartilaginous joints and the second one is called as your secondary cartilaginous joints. What are these primary and what are these secondary? Primary cartilaginous joints are the joints which are appearing from birth. What do you mean by appearing from birth? Immediately the baby is born, right? If you look at the bones of the baby, within the bones there are some joints that are located. So these joints are developed after the birth or during the birthing process. I mean during the time of the development in the mother's womb, that time only these joints might have been developed, right? So that is why these joints are called as primary cartilaginous joints. What are secondary? Secondary cartilaginous joints are those joints which develop after the birth. After the birth, let us say after 5 years of birth, 6 years, है ना? Birth होने के बाद after 5 or 6 years, slowly these joints will develop and these are called as your secondary cartilaginous joints. Okay, so what I'm trying to tell you is that, yeah, very good. Primary cartilaginous joints, they appear from birth. Okay, secondary cartilaginous joints, they appear after birth. They appear after birth. Okay, what is an example? Example is, all of you look at this bone over here. This bone which I am drawing in front of you, the name of this bone is femur. Okay, this bone is called as femur, right? This bone is called as femur. Now, this bone which you can see, this is the real femur. Okay, femur is the strongest bone in your body. Okay, right? We will discuss about femur in detail. Okay, kahan pe fractures hoga, everything we shall discuss in detail. But all of you know from your +1 and +2 that is femur. Any bone, any long bone you take, we have got three important parts. The ends of the bones, है ना? ये देखो, ये end और ये end, these ends are called as epiphysis. All of you know that, है ना? The middle shaft is called as diaphysis. So both the ends are called epiphysis. This shaft is called as diaphysis. Next, epiphysis or diaphysis के बीच में, this part you see, this is called as metaphysis. Okay, once again, these are called as epiphysis. The part which I'm holding right now is called as diaphysis. Epiphysis or diaphysis के बीच में ये जो है ना, this is called as metaphysis. In this metaphysis is having growth plate. That is the reason why this bone has grown so long. Okay, so it is because of this growth plate, right? Your bones are growing, you're becoming tall and tall, right? This growth plate is having a cartilage and that joint is called as cartilaginous joint or primary cartilaginous joint. Okay, so let us discuss about this right now. So I was telling you that this part is called as epiphysis. This part is also called as epiphysis. Okay, after epiphysis, the next thing, this center part is called as diaphysis. After this, I'm drawing now the blue part. Okay, this blue part is called as what? Metaphysis. Okay, so this is called as epiphysis. Okay, this is called as diaphysis and this is called as metaphysis. So very good, Anand Prakash, you're right. So metaphysis is having what? Metaphysis is having growth plate. Metaphysis is having growth plate. Okay, and within this growth plate there should be a cartilage. Why? क्योंकि ये cartilaginous joint है. So what is the name of this cartilage? Hyaline cartilage. This is called as hyaline cartilage. Okay, so this is a very important MCQ which was asked in a previous FMGE exam. Okay, in previous FMGE exam they asked about this. Very important. Very good, all of you are right. Very good, your answers are right. Very good. Okay, so from today onwards, if someone asks you what is an example of primary cartilaginous joints, your answer should be hyaline cartilage. Okay, that is located in the metaphysis. Right. Now, let us discuss about secondary cartilaginous joint. Secondary cartilaginous joints are, how to remember this? Very easy. All the joints which are located in the midline of your body are called as secondary cartilaginous joints. Midline मतलब यहाँ पे midline में कौन सा bone है? What is this bone? Breastbone. Breastbone का what is the other name for breastbone? Sternum. Right? If I'm going down, there I will have one more bone called as pubic bone. All of you know, right? So joint between the two pubic bones is called pubic symphysis, right? I hope all of you are understanding all of these things which I'm telling you, right? So secondary cartilaginous joint example we'll see now. Okay, what are these secondary cartilaginous joints? See, this part which I'm drawing right now, this is your sternum and this is your xiphoid process. And down if I go a little bit down, here I have got two bones, right? What are these two bones? Just look here now. These two bones here are called as pubic bones, right? So the joint that is present, and by the way, let me tell you one more important thing. This is called as manubrium. This is called as manubrium. Okay. This is called as a body of sternum. And this is called as a xiphoid process. This is called as a xiphoid process. Okay. So there is a joint between manubrium as well as the sternum, and this joint is called as manubriosternal joint. This joint is called as manubriosternal joint. Simple things, guys. So anatomy don't feel difficult. Okay, anatomy is all about mixing two names. Okay, joining two names and spelling it out. That is what is anatomy. Manubrium, body of the sternum, together you call it as manubriosternal joint. Okay, now you will tell me, if I mix two words, manubrium and sternum and xiphoid process, what will be? This is called as xiphosternal joint. Okay, xipho. Very good, very good, very good, very good. Xiphosternal joint, xiphosternal joint, and obviously joint between the two pubic bones is called as pubic symphysis. Pubic symphysis. Sir, what are the examples of secondary cartilaginous joints? One is manubriosternal, second is xiphosternal, and third is pubic symphysis. Okay, what are the examples of primary cartilaginous joints? Hyaline cartilage, that is a growth plate. So right now all of you understood what are the cartilaginous joints. So this is all the discussion about the cartilaginous joints which we are able to discuss, and we discussed it. Okay, green signal maro. I'll go to the next most important thing, that is the synovial joints. In synovial joints I'll also show you the cases which I have dealt in the hospital. Okay, so when I was working in the hospital back in Hyderabad, so that time I got some cases where there is septic arthritis, the complete joint erosion and all. मैं वो cases भी दिखाऊंगा आप लोगों को right now. So all of you understood? Thank you so much, Nagesh. And some of your parents, most of your parents might also be doctors, so it is a very good time for you to ask them about their experiences, their hospital experiences about these joints and all, right? If some of them are orthopedic surgeons, so that would be very nice for. Very good. Chalo. Let us discuss about the third important. Let us put a tick mark first of all. पहले tick mark, उसके बाद we'll discuss the topics. चलो, fibrous finish है ना, cartilaginous joints finish. Now we shall discuss about synovial joints. This is not chai. This is this is black coffee. This is not chai. Even if it is cold, also I drink. No problem. Right. So let us discuss about synovial joint. Okay. Now, Very good, Patan. So that would be a great opportunity for you to ask him and know his experiences regarding these joints and accidents. Okay. So within the synovial joint, what are the important things? So you know some important things regarding the joints, right? Now, regarding these synovial joints, guys, you know the typical structure of a joint. In your +2 biology textbook, you will see a typical structure of a joint. Okay. So what is a typical structure of a joint? Let us say this is one bone. This is another bone. Okay. We have got two bones. Okay. Now look here, the surface that is lining this one bone, this blue color thing which I'm drawing right now, you know, this blue color thing is called as articular cartilage, right? So this blue color thing which I'm drawing right now is again called as articular cartilage. Guys, don't write anything, just watch whatever I'm teaching you. Okay, I'll give time for you to write later on. However, this video will be recorded, don't worry. So these are called as articular cartilages. Okay, this is called as articular cartilage. Articular cartilage. Okay. Now, surrounding the joints, there are some layers. For example, see, there is this layer which is located on the outer side, right? There is this layer which is located on the outer side. This is called as fibrous layer. What is this layer called? This layer is called as fibrous layer. Okay. Just beneath the fibrous layer, we have got two more layers. See, there is this pink color layer on both the sides. Okay. And there is this green color layer on both the sides. Okay. Now, what is the name of this pink color layer? This pink color layer is called as tunica intima. What is this called? This is called as tunica intima. Okay, just beneath this tunica intima, we have got another layer that is called as tunica subintima. Why sub? Again, anything below is called sub, anything above is called supra. Okay, फिर से बोल रहा हूं, anything below is called sub, sub का दूसरा नाम है infra. Okay, anything below is called sub or infra. Okay, anything above is called only one, that is supra. So this is called as tunica subintima. Tunica subintima. Okay. Now this tunica intima and tunica subintima, both of these layers together you call them as synovial layer. Synovial layer. Synovial layer. Okay. I'll give you the notes, Patan. Don't worry about that. I'll give you the notes. Right. So if someone is asking you what are the layers that are surrounding the synovial joint, what you should tell? There are two layers. One is called as outer layer and inner layer. Outer layer क्या होगा? Outer fibrous layer and inner synovial layer. And inner synovial layer is again divided into two. Outer tunica intima and inner tunica subintima. Clear all of you? है ना? यहाँ तक तो clear है. And all of you know that I told synovial joints मतलब क्या? Synovial joints are those joints which are having synovial fluid in between, right? So this is a synovial fluid that is located in between the joint. Okay, this is the synovial fluid which is located in between the joint. So this fluid is called as synovial fluid. Synovial fluid. Actually guys, ये synovial fluid है ना, this is completely sterile fluid. You won't even find a single microorganism within this fluid. But for example, if you find any bacteria within this fluid, पूरा synovial fluid infect हो जाएगा. అవునా కదా, మొత్తం synovial fluid అంతా ఇన్ఫెక్ట్ అయిపోద్ది. సో synovial fluid మొత్తం ఇన్ఫెక్ట్ అయిన తర్వాత, if there is complete infection of synovial fluid, that condition you call it as septic arthritis. Okay, the entire joint will be damaged. The bone above, the bone below, and the layers surrounding it on the side, all of them will be damaged. That is called a septic arthritis. One day, when I was in my clinic, I got a case, right? 11-year-old guy, he was having septic arthritis. So this is a case of septic arthritis, guys. You see the joint, how damaged this joint is looking, right? Right. Yeah, by the way, Medigir 3, So this is having many components, okay? These are having many factors and all, right? And it is also having hyaluronidase and many other things that will be discussed in physiology, okay? Right. Now what I'm trying to tell you is that now let us enter into the clinical part. So still here all of you understood, right? Very good. Very good. Very good. Very good. Very good. Now we shall enter into little bit clinical part. What is that clinical part? All of you know that here we have got a muscle. Let us say some random muscle. I'm not going to tell the name of the muscle, just a muscle. Okay. In your +1 and +2, you studied muscle is ending with what? Tendon, right? Muscle directly does not attach to the bone. Muscle attaches to the bone with the help of tendon. So this is the muscle and this is the tendon that is attaching to the bone. Okay. अब ये देखो. Now I am drawing one very important thing here. You can see this green color thing which I'm drawing, and this green color thing is having some blue color fluid. Okay, what is this actually? This is present between a tendon and it is also present between the fibrous layer. This is nothing but called as a bursa. Bursa क्या होता है in anatomy? From now onwards, you should learn about bursas. What are bursas? Bursas are nothing but a cushion-like thing. For example, if I'm standing on the road, from the side, vehicle comes and hits my knee. Obviously, knee will be damaged. Okay? Vehicle छोड़ the cycle. With a cycle, someone is hitting my knee from the side. What will happen? My joint will be damaged. So to prevent the joint damage, I need to put a sponge on either sides. Yes or no? So this is like a kind of sponge. This sponge is nothing but called as a bursa, which will provide a cushioning effect. I hope you are understanding whatever I am trying to tell you, right? So this bursa, which is located near the synovial cavity, you call this as a synovial bursa. Okay, so this is called as synovial bursa. Okay, the entire knee joint clinical anatomy is winding around this synovial bursa only. Okay, so this is the normal anatomy of your knee joint. So this is the view which you are looking from the front side, right? If you are looking from the lateral side, okay, from the side, what are the important things will you find? All of you just pay attention. This is a knee. Right. So all of you know, this is your femur bone, right? This is your tibia bone. Okay, femur and tibia. And between your, in the front of your knee, what is the bone that is present? Sesamoid bone. What is that? Patella, right? So this is your patella. P stands for patella. Okay. Now, right. So this is your knee. Okay. And I already told you that we have got a muscle like this, right? And muscle is having a tendon which is attached to the bone here, right? And now I will discuss about the bursas, guys. Okay. Now I'm drawing a bursa in front of a patella. Yeah, देखो, this is a bursa which I'm drawing in front of patella. So anything you're drawing in front is called pre. Anything back of it is called as post. Right? Now the camera is in front of me. This is called pre. Right? Now back of me, if there is a screen, that is called as post. Now you will tell me, what is this bursa? Pre-patellar bursa or post-patellar bursa? This is called as pre-patellar bursa. Pre-patellar bursa. Pre-patellar bursa. Okay? Now, if I am drawing a bursa above the patella, ye dekho, I am drawing a bursa above the patella. If I am drawing anything above is called again supra. Anything below is called sub or infra, right? So this bursa over here is called as suprapatellar bursa. Suprapatellar bursa, right? And let us say, let me draw a bursa below the patella here also, and this one is called as infrapatellar bursa. Actually, guys, ये infrapatellar bursa में within this infrapatellar bursa, there are superficial and deep also. I'm not going into that detail. Just remember, below the patella, whatever bursa you have is infrapatellar bursa. Let me enlarge this patella, draw this patella a little more big. Okay. Right. So how many types of bursa we have got? Prepatellar bursa, suprapatellar bursa, and infrapatellar bursa. These are the three different types of bursa. Now guys, all of you just think logically. Okay. For example, if you are kneeling down, you know, for example, every day in the morning to your home, the servant, right? So she comes, she or he, whatever it is, they come and they completely mop the floor, right? So when your housemaid is completely mopping the floor, she's not even working in your home, she's working in different homes. Yes or no? So she'll work for 1 hour in your house, the next hour to another house, the total day she keeps on working, she keeps on kneeling down and mopping the floor. So when she is kneeling down for a long time, don't you think the prepatellar bursa is against hitting against the floor? So constantly this cushion or prebatellar bursa or a pillow, this is constantly rubbing against the floor. When it is keeping on rubbing, don't you think one or the other time this prepatellar bursa will undergo infection, right? And that infection, you call it as housemaid's knee. What is that you call it as? You call it as housemaid's knee. Housemaid's knee. Okay. So from today onwards, if I ask you what is housemaid's knee, you should tell inflammation or infection of prepatellar bursa is called as housemaid's knee. Clear all of you? Second important thing. For example, you know, you visit to the church, right? In the church, the father, right, he will kneel down on a slanted, let us say, on a slanting wooden plank, he'll kneel down there, right? So when he's kneeling down, actually the lower part of the patella isn't touched with that plank. Okay, it is in constant friction with that plank. So what will happen is that this lower part of the patella will also undergo infection, and this is called as clergyman's knee. What is this knee called as? Clergyman knee. Clergyman's knee. Clergyman's knee. So today you understood two important concepts. एक होगा housemaid's knee, another one is called as clergyman's knee. Okay, sir, suprapatellar bursa will not be infected. Very rare cases. Okay, very rare. When you are kneeling down, only these two bursa will touch the floor. Suprapatellar will not touch the floor. If you want, you can also check. Right. So these are very rare cases. And very good, Anand Prakash. You're perfectly answering. So you understood this till here, guys. Now let us do the patient. Now let us look at the patients, and you will diagnose me and tell me what is the condition below. Are you all ready? You understood all these things till here? Yes or no? Are you all understanding? You understood. So shall we start the question? Very good. Very good. Very good. Don't have any doubts, right? Yeah. And fun mode is asking, synovial fluid is secreted by the synovial membrane itself secretes this viscous fluid called as synovial fluid. Okay. Very good. Now you will tell me, again, now you will tell me this case. Let us say patient number 1. Okay. This is his right leg. This is his left leg. Now tell me which leg has got a problem. By looking at his leg, by looking at his knee, I can very easily find out that the left leg has got a problem. I'll repeat it, Devendra. Once we are done with this, I'll repeat it. Okay. So we have got a problem with the left knee. Now here you can see a bursa. First thing I'll tell you, remaining to you tell me. Okay. You can see a swelling in front of patella. So if there is a swelling in front of patella, you call it as what? Housemaid's knee. So this is a typical presentation of a housemaid's knee. Okay. Now let us look at question number 2. Now here, all of you look here. This is the right knee, left knee. Again, in this patient also left knee is a problem. Now tell me, is this a case of housemaid's knee or is this a case of clergyman's knee? Yes. Very good, very good, very good. This is again housemaid's knee. Why? Because there is an infection here in front of the prepatella, right? This is prepatellar bursitis, right? Infection of the prepatellar bursa. Very good, all of you. Now, tell me the third important thing. Where is the bursitis present here? Where is the bursitis present here? Where is the bursitis present? See, don't confuse telling that this is patella. No. This is patella, okay? You have got bursitis in front of patella, I mean below the patella. So this is a clear-cut presentation of infrapatellar bursitis or clergyman's knee, right? This is a clergyman knee. Very, very good, very good. Lipica, not supra. Lipica, that's what I'm telling. This is normal patella, okay? It is just below the patella. I know most of you might be thinking this is patella, right? No, this is not patella. This is a swelling, okay? Very good. Now all of you tell this one. This is very clear. See, this is patella again. Very good. In below the patella, you have got a swelling like this, right? So this swelling is called as infrapatellar bursitis. Very good, guys. I'm really happy that you're understanding. Very good. Now, guys, let us look at the scans, okay? Let us look at the MRI scans. Now, before I teach you MRI scan, one very important thing you need to know is that if you want to locate an infection, right? If you want to locate a swelling or an infection, when you look at an MRI scan, you will see a hyper intensity. Hyper intensity matlab, in simple terms to tell, you will see a bright white color thing. Wherever there is bright white color in the MRIs which I'm going to show you now, there is a problem. Okay. Now it is your turn to answer me. First of all, let us look at a normal MRI. In this normal MRI, you can see this number 1 over here is your femur bone. Femur. Just beneath the femur, number 2 is called as your tibia bone. Okay. Where is patella bone? Right. So this is your patella. Number 3 is called as your patella bone. Okay. Number 3 is called as your patella bone. So these 3 things you should know. Sir, then what is this one? This is actually a fat pad that is located below the patella. This is called Hoffa pad. Okay. There is a fatty tissue that is located. There's fat that is located below the patella that is called Hoffa pad. You will study these things later on. Don't worry about now. Right. So just you identify 3 bones: femur, tibia, patella. Clear? Now let us look at the MRI scan number 1. Patient number 1. Patient number 1. Where is femur? You see, this is a femur. Where is tibia? This is tibia. Where is patella? This is patella. Now tell me, this is a clergyman's knee or a housemaid's knee? You can very clearly see a bright white color thing here. You can see a very bright white color thing. Bright white or hyper intense lesions which you can see here are the problem, is the lesion which you can identify over here. Very good. Riya Singh, perfect. Suraj, Anand Prakash, Lipika, perfect. Perfect. Ashwat, Najmul, very good. So this is housemaid's knee. Very, very good. Housemaid's knee. This is a housemaid's knee. Very good. Akshata Mali, very good. Mansi Patil, very good. Mansi, very good. Now let us look at MRI scan number 2. In this MRI scan, फिर से, this is your femur, this is your tibia, and this is your patella. Now tell me, where is the infection? Above the patella, below the patella, in front of the patella? Very good, very good, very good. See, again it is located in front of the patella. Very clearly you can see it is located in front of the patella. Again, this is called as your housemaid's knee. Housemaid's knee. Okay, this is also your housemaid's knee. After this, now let us discuss about the next important thing. Now look at this, guys. Now you will tell me the answer. Okay, this is femur. Okay, this is tibia and this is patella. Now tell me, where is the infection? Now this is a prepatellar bursitis. I mean, is this a housemaid's knee or is this a clergyman's knee? Tell me. You will answer me now. Very good, Devendra. Very good. Very good. Very good. Very good. Below the patella. So this is a clergyman's knee. This is a clergyman knee. Okay. So this is a clergyman's knee. And the final one, I'm going to tell you, femur, tibia, patella. And again, your answer, please. What is the final MRI? Very good. It is located beneath the patella. Very good. Very good. Just in front of patella. Again, it is housemaid's knee. This is housemaid's knee. Okay. Housemaid's knee. Right. So guys, what we shall do is that in the next session, we shall discuss what are the different types of synovial joints. Okay. So we shall discuss what are the different types of synovial joints in detail. Okay, and then we shall continue with our next topic. So I'll tell you in the what will be the next topic tomorrow, right? But till today, whatever I have told you guys, so all of you understood all the topics, which I have discussed. And one last important thing, I want to tell you is, all of you look at this joint over here, guys. This joint here, joint number 1 and joint number 2. Joint number 1, the surface is very smooth. Hai na? Why the surface is very smooth? Because this joint is having articular cartilage. वो blue color line जो मैंने draw किया था, you remember? This is an articular cartilage. But look at this joint here. Do you think the articular cartilage is smooth? No. Some points the articular cartilage is damaged. Right? You see some points the articular cartilage, it looks like the articular cartilage is eaten off. Right? What is this? You know, this is called as erosion of the articular cartilage, right? Or degeneration or damage to the articular cartilage. And this condition is called osteoarthritis, which is most commonly seen in individuals, older individuals of more than 60 years, right? You know, your grannies, grandfathers, right? They keep on complaining that they have got knee pains, right? And if you look at the joint also, that will be a swollen little bit. Why? It is because of osteoarthritis. So this condition is called as osteoarthritis. Osteoarthritis, okay, which is most commonly seen in elderly people after 60 years. What is the treatment you can do, guys? There is no better treatment, right? The only one treatment is knee replacement surgery you can do, right? If non-surgical, if they're afraid of surgery, then lifelong you have to use NSAIDs, okay, non-steroidal anti-inflammatory drug. You will study about this, don't worry, don't think about this right now itself. This is how you need to study. And one last thing I'm going to tell you is that once when you enter into your MBBS, right, don't expect anything from anyone. Even it might be in India, even it might be in abroad, anywhere it might be, no human being can teach the entire MBBS. MBBS is an ocean, okay? They can help you till some extent, anywhere it might be. So what I'm trying to tell you is that always and always make this passion of self-studying. Self-study is very, 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 very important. The number of hours you sit, the number of hours it's gonna be fruitful later on. Whatever you are studying, अच्छे से notes लिख लो, right? Maintain a notes. Weekly once you revise the notes. Weekly once. Okay, so if you keep doing from day one till your final year, I'm telling you, you will be super perfect with everything. But if you don't study, later on it will be a torture for you. Later, really it will be a torture. Okay, so the first MBBS, second year and third year, these 3 years are the best years, I'm telling you, to form a very good basics. Because anatomy, microbiology, biochemistry, pathology, pharma, so all these are basic subjects are located in first, second, third year MBBS. If you are perfect with this, the remaining like medicine, surgery, forensic, whatever it is, all the subjects going to be super easy for you. Okay, so this is one last thing I want to tell to you, right? A small thing like an advice. So this is all the things, guys. Thank you so much for watching my video again, right? Coming to the live session. So I hope this session was really fruitful to all of you. Thank you so much. And let's meet tomorrow. Until then, take care and goodbye.